Yeah, so it's now recording, so I think we can go ahead and get started.
Sounds good. Well, like Bill said, thank you for joining. I'm Nicolene. I'm the VP of Clinical Services here at Accurate, and thanks for taking time to be with us today. I don't have a tremendous update for today, just a couple of things. Of course, COVID that we've been talking about for, I don't know, a year and a half now, it feels like. Please do stay diligent with that. It's not gone, it's still around. We encourage you to get vaccinated if you haven't already. And if you have been vaccinated, we encourage you to send that information to HR. It's not required, but it does make things easier. We're starting to see patients who are requesting care providers who are vaccinated. So that's something that we'll handle on a case-by-case basis, but that certainly is becoming more common. So again, you know, by now it's really easy to get vaccinated. You can do it on a whim when you walk into, you know, I was just at CVS yesterday, and there's a sign that says we have Johnson & Johnson vaccines available. Walk in right now. So you could do one and done. So if you have already been vaccinated, thank you for that and for helping to protect our patients and the public at large. Also makes those conversations a lot easier when you call us to let us know that you have a COVID exposure. One of our first questions, the RN clinical manager team or myself will ask you is whether you've been vaccinated or not. If you have, the conversation pretty much ends. That protects you in those high-risk exposure situations, so you don't need to sit home from work for an extended period of time and disrupt your patient's care. So again, we encourage that. And even if you have horrible symptoms from the vaccine, which I could say I did, it passes. So please do consider that. Also, Minnesota Home Care Association has let us know that they are working with Minnesota Department of Health to get that PPE requirement grid updated. I've sent out links to that several times, but at this point, our requirement remains to wear both a mask and eye protection while you are providing care in patient homes. So while masks may be gone out in the rest of the world, as a healthcare worker, you are still required to wear a mask and eye protection. So whether that's a face shield or goggles, you do need to wear those while you're providing care. MDH is still completing infection control surveys and citing agencies for field staff not wearing that. So please be sure to do that. Finally, one just kind of fun facts update. Just this morning, I was speaking to students at the University of Northwestern down in Roseville, and they will be completing some clinical rotations in a couple of our patient homes. So great opportunity for people to learn more about home care, and hopefully they will be some of your future colleagues. So if you work with a patient, nursing patient, but if you work with a patient who is interested in hosting students, please reach out and let me know. I would be happy to have a list of students who are, of patients who are willing to work with students so that I can coordinate those clinicals. That is one of the best ways to get nurses to know about home care. So are there any questions for me? All right. Bill?
Thanks. So I have several things I'd like to just go over here. I want to remind everybody that this is being recorded and that it'll be available for playback later on through the Paylocity portal. And to that end, please know that our communications to you, when we need to communicate en masse, it's going to now be through the Paylocity portal as opposed to sending out emails. You'll get a notification email from Paylocity saying there's an announcement to view or there's a conversation to look at or something like that. So it might be a little bit benign that way, but we just want you to know that we're really driving our communication model now through the Paylocity portal, rather than trying to use SurveyMonkey for surveys and MailChimp for emails and things like that. Financial update, we are very close to being break even. We're still losing a little bit of money every month, but for the most part, the major losses are behind us. And I think we're just becoming more and more financially stable every month. And I just wanted you guys to know that we're continuing on the right path financially. And I anticipate that the fourth quarter of this year will be a much better quarter for Accurate Home Care than we've probably seen since early 2016. So just know about that. Our home health practice is continuing to grow. We're now at a census of about 180 patients. Our goal is to hit 300 or more by the end of the year. If you happen to know any RNs who want to become case managers, or RNs or LPNs who'd like to be visit nurses or home health aides, those kinds of home health positions, just let us know. And you can get a referral bonus for referring somebody in if you'd like to do that. Electronic visit verification is now mandated by the state of Minnesota for PCA and homemaker care providers. And that's going to go into effect on December 1st. Right now, we have about a third of our care providers. We have about 350 PCAs and homemakers overall. And I think the last time I looked, it was at 103 or 105, right in that range of PCAs and homemakers that we have moved over to electronic visit verification. Everybody else in those two service lines will also need to move over by December 1st. Our clinical managers are working on they have a schedule, and they know who they're going to try and move each month. And that's going to be happening. This is going to require that our PCAs and our homemakers have smartphones. Flip phones aren't going to do it, and tablets, unless you have a tablet that you're willing to hook up to a cell phone carrier, those would work as well. But just know that that this is already underway, and if you're a PCA or a homemaker, that this is something that's now required by the state. Let me stop there and see what kind of questions or thoughts people might have.
What happens if we don't have cell service at our house? I don't own a cell phone.
I'm not sure, to be honest with you. I don't know. I don't think MDH has a paper option, do they?
There is, so CanTime has, the CanTime is our electronic medical record, and they have an app that can be utilized called CanTime ICE that can be utilized offline capability. So then it would be a matter of syncing it when you do have service.
Do you not have any service at your home at all?
I've tried every cell service there is. I have a internet. I have a desktop computer. Every cell phone I have used, I don't get service in the house. I have to stand outside in my driveway and hop on one foot. And the day that I fell off the deck looking for bars is the day I quit bothering with cell phone.
That's a good time to give up for your safety. No, internet connection is just fine. That will count. So we'll
do it on my desktop computer.
No, but you could connect a device to Wi-Fi. So we'll handle that on a case-by-case basis. Are you providing patient care in your home?
Yes, my son is the client.
Sure,
Okay.
sure.
Yeah.
Yep, so your clinical manager will help troubleshoot that situation. And for nursing EHN patients and families, that mandate will be in place by January 1st of 2023. So we have more time for conversion of nursing services. So right now it's PCA and homemaking.
Well, I'm PCA, so.
Okay, yep. So your clinical manager will be talking with you about that to get things going by December 1st.
Okay. I work for two agencies, and the other agency had this up and running already, but I was able to use the computer rather than a cell phone.
Sure. Yep. Okay. We'll take a look at it with you.
Okay.
Any other questions about EVV? So moving on, while this doesn't affect you all personally, it's just good to know that we have downsized our footprint here in the Otsego office. And we have also hired Keller Williams to help us find a sublessor for our space so that we can move to better space for us that's also more economical. It's just another example of how we're trying to incrementally cut costs so that we can become more financially stable. Just, I know you guys don't come here to the office, but it's good to know what's going on sometimes here. Just want to remind everybody that the referral bonus is still available. You can refer nurses and PCAs and homemakers to us for employment, and assuming everything works out well, you can, for a nurse, you can earn $3,000. So I just want to remind you that referral bonus is still in effect. We have right now on our current EHN needs list over 6,000 hours of patient care that we need to staff that we cannot staff because we cannot find enough care providers. And so if you happen to know of an LPN or an RN, you're welcome to refer them either for home health or for EHN, and we will certainly pay you for that. And this applies. So if you're a PCA and you know a nurse and you refer her, you get the same 3,000. It's not discounted because you're a PCA. So this is a great way for homemakers and PCAs and other nurses to bump their pay by an hour, $1, or maybe even $2 an hour, depends on how much you work, just by making referrals. And so I just want to remind everybody of that. I also want to remind that we do have tuition assistance programs for nurses working on their BSN, and we have a student loan forgiveness program for our nurses, and as well as our ILS, Independent Living Services workers, as they come on board. Let me stop there and see what kind of questions or thoughts there might be before I move on to a couple of other items here. Okay. We just also want to remind you to stay current on your Relias training, to stay current on your professional development. We have gained this house so that it's about an hour a month, give or take. Some months will be less, some months will be more, but it averages out to be about an hour a month of education. And we would appreciate it if you would please log into Relias and make sure that you're getting your training done on time. And then if you happen to know of an Accurate employee who's gone well above and beyond the call of duty, so to speak, and they've really stepped outside their comfort zone and their job duties to help a patient or to help another employee, I'd appreciate it if you'd let me know that. We're doing above and beyond recognition awards on our website, and these are only for Accurate employees, and appreciate you just letting us know about that. So any questions or thoughts about this or anything else at this point that you'd like to bring up? So this is your time to ask us any questions, no matter how off topic they might seem or how detailed or insignificant they might seem to you. This is your time to ask questions. Well, Nicolene, did you think of anything else then?
I did not.
Okay. Well, just make sure that you're checking Paylocity and that you're logging into Relias. And you're always welcome to ping myself or Nicolene offline with anything, any concerns, any questions. We're here, we're available to you. And I just want to thank you all for coming today. And I hope you have a good day. Take care.
Thanks, everyone.